resolved, and he will speak for about 45 minutes, and then we'll have an opportunity for questions at the end. And as Suzanne said, les questions peuvent être en anglais, en français, ou vous pouvez en anglais. Merci.
Thank you. Good morning. It really does give me great pleasure to be here, and I want to take a moment just to thank Concordia University for inviting me. I'm really pleased and very flattered that they did. I might start by just asking you, since we're discussing violence, I wonder how many of you know what Jack the Ripper and Winnie the Pooh have in common. This is a thinking person's riddle, so
well, that excludes most of us.
I want you to take a moment to think about this. Jack the Ripper and Winnie the Pooh, what do they have in common? Anybody know? Excuse me? All right, I'll tell you. They have the same middle name. Now, I always like to start with a stupid joke because then everything that follows is a vast improvement, and I'm sure will be deeply appreciated. Okay. I think a brief caveat to the audience is in order. Some of the concepts, the principles, and the recommendations contained in my presentation will at first glance appear, at least to some of you, a bit unorthodox, and especially coming from a psychotherapist and administrator of a college mental health program, perhaps even a bit peculiar. I sincerely hope they will arouse your interest and provide you with a useful and relevant framework with which to consider the problem of the disruptive college student. The findings I will present are based upon clinical experience over the past 20 years in the City College of San Francisco mental health program. The mental health program where I work is an on-campus psychological service which provides short-term, 10 to 12 session psychotherapy to community college students. In addition to my role as an administrator of this program, I have served as a consultant to many other colleges and universities in California, largely for the purpose of addressing the problem of the disruptive college student. Thus, the conclusions and recommendations outlined in the following discussion generally reflect, I believe, the intense concerns of a great many college personnel, and I think this audience certainly reflects that, on the campuses of my own state, California, and most likely throughout both of our nations as a whole. As indicated in an earlier article I had written in the American College Health Journal, which Nancy just mentioned, over the last several years there has been a sharp rise in a number of disruptive incidents reported on college campuses. Although many of these incidents, such as fighting, plagiarism, and date rape, involve students who are quite diverse diagnostically, there's little doubt that a disproportionate number of the disruptive incidents that are reported by college employees involve students with serious psychiatric disabilities, such as manic depression, schizophrenia, as well as some of the serious character disorders, particularly the acting out borderline personality disorder. Several explanations have been adduced for the large increase in the number of seriously emotionally disturbed students attending colleges. Legislative changes that have helped to retain and treat psychiatric patients in their local communities. And I don't know, of course, the experience here in Canada, but is it similar? Two, advances in the use of psychotropic medications with which to stabilize psychiatric patients in local non-institutional settings. And three, the well-structured, culturally rich, and hospitable qualities of the college campus itself that are surely inviting to most students, including, quite understandably, those with psychiatric disabilities. There are an infinite number of reasons that explain why the emotionally disturbed student may become disruptive. To generalize somewhat, however, it might be helpful to realize that many, if not most, of these students must live tenuously with profound and chronic anxiety, so much so that even the slightest academic setbacks and disappointments may throw them into great turmoil. In response to their internal states of chaos and vulnerability, they often make their pleas for help and support by behaving bizarrely and disruptively. In this regard, I recall a schizophrenic student who began giving out to his classmates strawberry shortcakes during a final examination. As I later learned in the therapy session with this student, he had feared the impending termination of the semester because he would temporarily lose the security of attending college, and therefore, mostly unconsciously, I suppose, he behaved in a demonstrably bizarre manner, the shortcake episode. in order to be hospitalized and taken care of, which he was for several weeks. In determining the causes of disruptive behavior, it's important, I believe, not to focus exclusively and myopically upon the psychiatric disabilities of seriously emotionally disturbed students. What I mean is, the colleges that are currently beleaguered by disruptive students must begin to ask themselves if they are providing these students with suitable educational and psychotherapeutic programs that might enable them to adjust non-disruptively to the college environment. In my own state, California, too many colleges, especially, I must say, the community colleges, are woefully ignoring the needs of this population. Too often these colleges hide behind the belief, or if you will, rationalization, that emotionally disturbed students should not be permitted to attend college in the first place. And there are many who believe that, and therefore are not entitled to specialized programs. Well, as most of you must know by now, the emotionally disturbed student is here to stay. And if our colleges don't serve them properly and effectively, a small percentage of them will be highly and frighteningly disruptive. And if we do not provide better preventative programs for this group, the ultimate responsibility for their disruptiveness will be, at least in part, our own. Looking at the larger society as a context for understanding this problem, the societal causes for the rise in violence and disruptiveness on the college campuses of our two nations are well known and legion. The ubiquity of drug abuse, the widespread breakdown in the respect for legitimate authority, and the general weakening of traditional ethical values are all obvious and major contributors. Alcoholism, of course, quite often plays a principal role as an instigator of violence, crime, and disruption. But where do we begin? When we try to identify the causes and culprits behind these problems. Can we perhaps blame the media? After all, in the United States, a child will see alcohol consumed an average of 75,000 times on television before he or she is of legal drinking age. Murder and violence are, of course, the centerpieces of most of our television programs. But who religiously watches these programs and who purchases the products of their sponsors? Obviously, when we think about these issues and thoughts, our thoughts become discouragingly circular. No discussion of violence and victimization can actually be complete without some reference, I'm afraid, to the problem of date rape. And I've had, unfortunately, an opportunity to study this problem along with some of the other examples of violence. So I'll just briefly share with you some statistics based on a survey that was done a few years ago that are rather horrifying, and some of you may be familiar with them. A 1985 national survey of over 6,000 students on 32 college campuses revealed that 1 in 8 women have been raped. The study also indicated that 85% of these incidents occurred among students who knew one another, and 5% of the attacks involved more than one assailant. These have come to be known as acquaintance rapes or date rapes. 3/4 of the victims of acquaintance rape did not identify their experience as rape. And none of the males, none involved, believed that they had committed a crime, not a single one. 45% of the males who committed acquaintance rape said they would repeat the experience. And more than 1/3 of the women raped did not discuss the experience with anyone, and more than 90% of them did not report the experience to the police. Rather horrifying statistics. In order not to get too bogged down in an abstract discussion of the shortcomings in our societies that manifest themselves in college student disruptiveness, I will now move on to a discussing my own model for dealing with the disruptive student. Although the following discussion may be of theoretical or heuristic interest, it's largely intended to be of practical value to those who will be encountering and attempting to resolve disruptive incidents on campus. As obvious and simplistic as this recommendation may seem, it's imperative, I believe, to point out that colleges should periodically review their codes of student conduct for the following. Are the codes clear, coherent, comprehensive, mutually compatible, and enforceable legally? Will they withstand legal scrutiny and review? In a random survey I made of about 12 community colleges in my own state, I found under the section dealing with student conduct in the college catalogs 8 schools with rather clear and explicit codes of student conduct. 3, with overly vague, ambiguous references to the need for general conformity to the social and moral standards of the campus community. And astonishingly, 1 college without any written statement at all regarding student conduct. Clearly, I think this latter college unnecessarily places itself in potential legal jeopardy. In reviewing the comprehensiveness of its student conduct codes, colleges should attempt to determine whether the codes will cover those forms of disruptive behavior that will most regularly arise on their respective campuses. Since obvious forms of disruptive behavior, for example, physically violent or overtly menacing conduct, are likely to be readily identified and included in the student conduct codes, colleges should take heed to also acknowledge in the codes, at least implicitly, that certain forms of passive and covert behavior may be regarded as quite disruptive as well. Examples of this kind of behavior are those students whose poor personal hygiene so seriously offend the sensibilities of classmates and instructors that the classroom becomes no longer a tenable educational environment. Or to use another example, the student who each day ostentatiously falls asleep in a class in which verbal participation is a clearly established academic requirement. Again, conduct codes should provide for the contingency of flexibly addressing passive as well as aggressive forms of disruptive behavior. In order to accurately determine the fairness, comprehensibility, and applicability of its codes of student conduct, those administrators responsible for formulating and ultimately enforcing the code should regularly review them with the administrative, instructional, and classified staff of the college. Do you use that term, classified staff, in referring to people, janitorial staff, custodial staff, secretarial staff? You use that term, classified? You call it support staff? Okay. Okay, I'll try to remember that if I refer to that group again. And the consultation, by all means, should also take place with representative groups of students as well. Naturally, in determining the legality of those codes, the designated administrator should carefully review them with the legal staff retained by the college. Concurrent with the periodical review of its codes of student conduct should be evaluations of those procedures that are to be used in order to implement the codes. In evaluating those procedures, care should be taken that each employee of the college understands what essentially constitutes disruptive behavior, to whom the reports of disruptive behavior are to be sequentially transmitted, and the range of options and prerogatives that are ordinarily available to those reporting incidents of disruption. If, due to the passage of time, the staff's recollection of these procedures becomes fuzzy, it probably behooves the designated administrator to either have them occasionally reviewed in departmental meetings or to develop and disseminate a procedural handbook, which can be readily utilized for troubleshooting incidents of disruption. Now, I'd like to talk a little bit about disciplinary sanctions. The emplacement of codes and procedures that govern student conduct must be predicated upon a college administration's readiness to impose disciplinary sanctions for disruptive behavior. It's advantageous, therefore, that the administrator who's responsible for carrying out disciplinary action endeavor to formulate and enforce a set of specified penalties for particular acts of disruption. Such a codified set of disciplinary sanctions need not be, of course, Hammurabian, and what I mean by that, of course, is eye for an eye, in spirit or substance, but should be reasonably and gradationally commensurate with the seriousness of each act of disruption. In other words, the punishment, if we want to call it that, should reasonably fit the crime. For example, in developing a hierarchy of disciplinary sanctions, a first-time case of plagiarism could perhaps result in a temporary suspension, if you prefer, while a physical assault upon an instructor or drug trafficking on the campus could conceivably result in the expulsion of the offending student. In the interest of fairness and justice, a hierarchy that couples specific disruptive behaviors with proportionate sanctions should allow for any possible extenuating circumstances that might ultimately mitigate disciplinary measures. For example, a student who has just learned that a parent was diagnosed with a fatal illness and soon afterward, quote, unprovokedly, unquote, deface college property might, taking into account his grief-stricken state, receive a milder form of discipline than would otherwise be the case. Nonetheless, an administration that has in hand a ready-made set of reasonably proportionate and humanely enforceable sanctions that specifically match a broad spectrum of potential disruptive behaviors will reduce its own likelihood of administering discipline in a precipitate, muddled, or discriminatory manner. And I want to second what Vice Chancellor Kenneth said yesterday about the need to temper and humanize disciplinary procedures. We have to continually monitor ourselves in that respect. A definition of disruption. In its broadest and most generic usage, the term disruption applies to behavior that persistently interferes with the academic and administrative activities of the campus. Ordinarily, such behavior actively hampers the ability of other students to learn and of instructors to teach. Extreme forms of this behavior may even threaten the physical safety of students and staff. Specific forms of disruptive behavior that commonly result in the administrative imposition of discipline are the verbal abuse of college personnel, physical threats or assaults upon others, the willful damaging of college property, the misuse of drugs or alcohol on college premises, and perhaps most commonly, the inordinate and inappropriate demands of students for time and attention from faculty and staff. That's the plaint that I hear most often. As mentioned earlier, the more passive and covert, albeit sometimes serious forms of disruptive behavior, such as a student's highly offensive personal hygiene, are ordinarily either overlooked or minimized until they arouse widespread and vocalized concern. Now, here are some guidelines and considerations for reporting incidents of disruption. The most common sources of reported incidents of disruption are predictably the college faculty, who by dint of their instructional duties have the most extensive and quite often nerve-wracking contact with disruption-prone students. Typically, by the time a faculty member reports an incident of disruption, the situation has reached quite serious, if not dire, proportions. There are several explanations for this fact. First, faculty are often reticent to report a disruptive student because they hope, often unrealistically, that benign inaction will lead to some form of spontaneous resolution. In other words, the instructor hopes that the student will somehow see the error of his ways and eventually shape up on his own volition. Second, instructors worry about the possibility that they will not be adequately supported by their administration if they report a disruptive student. Worse, they sometimes exaggeratedly fear that the problem will be seen as a reflection of their own professional inadequacies and that a resultant investigation will only lead to the discovery of their own blameworthiness in the matter. Third, some instructors feel that most forms of discipline, no matter how mild and warranted, are excessively harmful to the disruptive student, who is seen as too fragile psychologically to withstand the pressure of any disciplinary measure. And I see that quite commonly, instructors withholding discipline or even an admonition because they feel that the student is too disturbed and too fragile and will just somehow be dismantled by the imposition of the sanction. Finally, some instructors hesitate to complain about a disruptive student because they feel unprotected from reprisals from that student. Such fears, unfortunately, are not always unfounded, as we well know. Because instructors usually temporize before reporting a disruptive student, by the time the student's behavior is finally reported to the administration, it is usually, at least in my experience, it's usually recurrent, flagrant, and fairly insusceptible to change. For this reason, all complaints regarding disruptiveness should be taken seriously and duly investigated. Faculty who report disruptive students should generally be advised in the following manner. They first should be informed that they have, as instructors, two essential prerogatives. The first and most obvious is to establish and implement academic standards. The second prerogative is to establish and enforce reasonable behavioral standards for each class. In carrying out this prerogative, the principle of reasonable accommodation should be followed. That is, minor disruptions should be tolerated as well as possible, but major disruptions to the educational process should be met with disciplinary sanctions. It is normally very reassuring to faculty to know and appreciate that they do have rights and prerogatives to insist upon conformity to reasonable codes of conduct within the jurisdiction of their own classes and offices. A quite prevalent concern of faculty who report disruptive incidents relates to the matter of the potential dangerousness of the disruptive student. Although this concern is ordinarily quite disproportionate and groundless, it should never be dismissed out of hand. Even when there is no clear-cut evidence of a particular student's potential for violence and mayhem, no administrator or mental health practitioner can ever state with absolute certainty that the instructor is completely safe from harm. Instead, in disruptive situations that appear relatively innocuous, the instructor can be told that the student is probably not a potential threat to him or her. However, should she or he have any doubt or apprehension on this score, they should take whatever precautions are necessary to avoid the possibility of endangering themselves. Examples of such precautions are, for example, arranging to meet with a disruptive student only in the company of other staff, or firmly refusing to oblige the student at all who demands to continue unrelentingly a rancorous discussion with the instructor. In instances where there appears to be a definite and imminent risk of physical harm to the instructor, the student should be reported immediately to the designated administrator. And an administrative investigation and assessment should be immediately undertaken to determine the advisability of allowing the student to remain in the instructor's class. In California, based upon a relatively recent educational code, instructors may unilaterally, that is, without administrative approval, remove a disruptive student from 2 consecutive classes. Do you have anything like that here? Where instructors can actually unilaterally suspend a student for X number of classes? Some of you do. This is often a handy intervention because it buys time until the matter can be thoroughly and safely reviewed at the administrative level. In cases that involve recurrent, blatant, and clearly unresolvable disruptive behavior, but are not truly dangerous, except possibly to the morale and sanity of the instructor and the other students, a somewhat different tack may be necessary. Many of the students who fall into this category are demonstrably psychologically disabled and simply are unable to modify their disruptive behavior, even with the benefit of constant reminders, blandishments, or warnings. In such cases, it's perhaps best that an administrator privately meet with these students, apprise them of the fact that they are at an unfortunate and insoluble impasse, and that it's decidedly in their interest to withdraw from the class or the college as soon as possible. It may also be necessary to point out to such students that although no disciplinary action is currently under consideration, any further repetition of the disruptive behavior will likely lead to some form of penalty. To avoid the stigma of having that personally tarnishing outcome recorded in their academic records, and to relieve themselves perhaps of the burden of having to further struggle with a clearly irremediable situation, their immediate withdrawal would seem to be to their great advantage. In my own experience, when students are approached in this way, especially when the administrator's manner is empathic but firm, they generally and gladly accept the offer to withdraw without penalty. Not always. There are quite a number of exceptions to that. When they do not, the administrator must be prepared to carry through on the threat to initiate a disciplinary procedure in the event that the student continues to be disruptive. In formally transmitting information about disruptive student behavior, instructors should accompany their verbal reports with written documentation of their observations. This documentation should be devoid of psychological jargon or speculation. For example, this person appears to be a paranoid schizophrenic, or I think he's on drugs. Many instructors approach me that way, at least initially, because they feel that they're talking to a mental health professional, so that's part of it. They feel that they have to use psychojargon to communicate with me, and I try to change that around if I can. With as little editorializing as possible, the instructor should provide information that is specific and concrete, stressing only the student's unacceptable behavior. Finally, the documentation should be accurately dated and transmitted to the appropriate administrative officers for investigation and resolution. When a disruptive incident has already spiraled dangerously out of control and an instructor needs immediate assistance to deal with it, that assistance should be readily available. Therefore, the administration of a college has a twofold responsibility in this regard. First, it should ensure that emergency services, city or campus police, and/or a mental health or crisis intervention team are well in place and immediately enlistable. Second, all staff should be informed in writing about the procedures and resources that are to be used in the event of a dangerous emergency. Although this discussion has focused rather exclusively upon the role of the instructor in handling disruptive students, obviously instructional staff are not the only college personnel who must deal with student disruptiveness. Counselors, classified staff who work, we call it support staff, who work as secretaries and custodians, those personnel who manage the bookstore, and the administrative officers who themselves are ultimately responsible for administering discipline, are all from time to time involved in directly coping with disruptive student behavior. Therefore, the principles and procedures that have just been outlined for instructors should be considered valid and useful for non-instructional staff as well. Each college employee, irrespective of his or her particular professional assignment or work area, has the right to be treated with respect and dignity by students, and vice versa, of course. As one college report pointedly phrased the matter, suffering abuse is in no one's job description. No staff member or instructor should feel that they have to put up with bullying, intimidation, or violence. And I believe that's a quotation from Concordia University, is it not?
Yes.
Okay. The aversion to administering discipline is an interesting problem. It is quite common to find that college instructors and administrators are averse to meting out discipline, even well-deserved discipline, to disruptive students. There are several explanations for this aversion. First, discipline, especially admonitory discipline, tends to inflict psychic pain upon its recipients. Thus, unless the disciplinarian is an unregenerate sadist, he or she will administer discipline only with a degree of guilt, reluctance, and uneasiness. Excuse me. Second, many, if not most, college personnel easily lose sight of the potential positive value of discipline in coping with disruptive students. They often rather one-sidedly believe that discipline will necessarily serve only to exacerbate and escalate an already inflamed conflict. Puzzlingly, they may even hold to this position in the face of considerable evidence that their prolonged inaction has already inadvertently led to a serious escalation of the disruptiveness. You see this all the time. I'm sure you've encountered this, where instructors just hold out and say, you know, I don't want to upset the student. I don't want to inflame the student. And by doing nothing, the situation has gone from very bad to very, very bad to worse. It's interesting to watch that. Therefore, it's important for those responsible for disciplining disruptive students to realize that discipline is not inherently cruel or immoral. That just discipline measures in providing a form of external control may be exactly what a disruptive student needs in order to regain self-control. And that ultimately decisive discipline, in some instances, may be the only antidote for dealing with an uncontrollably disruptive student. In the end, as Pavella has pointed out, the imposition of a just punishment can affirm, it can sometimes, affirm and enhance one's capacity to make moral choices. Administrators in particular have several additional onuses to deal with when confronted with reports of disruptive behavior. In order to properly carry out discipline, they must first carefully evaluate the report they have received. Ordinarily, they must ask themselves, is this report credible? Is the instructor who has reported the disruptive student perhaps exaggerating or manufacturing the gravity of the circumstances? Where there is doubt about the credibility or accuracy of the allegations, it may be necessary to hold a formal hearing in which witnesses can be questioned and allegedly disruptive students can fully defend themselves against the charges. Based upon my own experience with the reports of such incidents, however, I would venture to say that in most cases of reported disruptiveness, the facts seem to speak loudly for themselves. The complainant is normally a quite credible, reliable, and rational person. And there is, therefore, a need for the designated administrator to act immediately and decisively in order to resolve the problem. Administrators often feel stymied and thwarted by the fact that some instructors who report disruptive students have not followed due process. In other words, those instructors who are petitioning for administrative intervention with disruptive students have not given sufficient warning to the offending students about their behavior and have not adequately documented their observations since the inception of the disruptive behavior. Administrators rightly consider themselves hamstrung when there's been very little adherence to due process because under the circumstances, they may later be professionally and personally vulnerable under the scrutiny of a judicial investigation or hearing. Nevertheless, there are two courses of action that can help to obviate this dilemma somewhat. First, if administrators discover that their staffs are too regularly overlooking the need to follow due process, it's incumbent upon them to develop written materials and in-service training activities with which to fully familiarize all employees with the need and procedures for fulfilling the requirements of due process. Second, in instances where there's an acute need for immediate intervention and due process has not heretofore been followed, administrators, if necessary, can accelerate and condense the entire investigative administrative process by requesting that instructors quickly and retroactively document the course of disruptive events, promptly transmit their written reports to the administration, and then suggest that they refer the student to the appropriate administrator for an immediate interview in order to review the matter officially. And it is possible, too, I think Pavella has recommended this, that you very well can use something known as an interim suspension. It's sort of an ad hoc measure to just call the student, recall the student from the class and have a period, a quiescent period in which matters can calm down and be investigated. So you can use that too. And most colleges, I think, are legally, I think that's legally allowable for the administrator to actually go ahead and do that, to impose an interim suspension. A further complication that fosters an aversion for and delay in the administration of discipline is the fact that most college administrators who serve as disciplinarians are middle management executives, often the deans of students, who do not truly possess the ultimate authority for resolving some cases of disruptive behavior in a way that is commensurate with their official responsibilities for meting out discipline. And when faced with complicated cases involving discipline, the administrator will often turn for help to the administrative superior, who in turn may consult the college attorney for a more authoritative legal opinion. The implementation of these multiple consultations will sometimes cause protracted and frustrating delays in resolving a disruptive crisis. Moreover, to further complicate matters, the final opinions and recommendations, and I imagine some of you have experienced this, the final opinions and recommendations of the legal staff may be inimical to the interest or desires of the college employee who originally reported the disruptive student. For example, an instructor who has been confronted with a highly disruptive and possibly dangerous student and is virtually at the end of her emotional tether will probably want the student removed and barred from her class immediately. The college attorney, however, may recommend that the college delay action until the instructor more adequately fulfills the requirements of documentation and due process. Administrators who occupy a position in the center of this crossfire of conflicting demands and perspectives are on the horns of a rather nasty dilemma. If, on the one hand, in deference to a legal opinion, they refuse to fulfill the terms of the instructor's petition for help, they can be subject to accusations of moral spinelessness and a dereliction of duties. And I've seen that happen many, many times. If, on the other hand, they opt to immediately grant the instructor's request by intervening despite an inadequate adherence to due process, they may later find themselves rather far out on a tenuous legal limb with few institutional allies or safeguards to protect them from students who might seek legal retribution. One method of escape that has been commonly used by administrators who are impaled on the horns of this dilemma is to refer disruptive students to counselors and mental health practitioners for evaluation and or therapy in hopes that this recourse will somehow ameliorate or resolve the crisis. For reasons that I will explain later, this plan of action is usually quite inadvisable, I think, and in many instances likely to be of questionable legality. Suffice it to say that here, that the use of this particular strategy usually results in an interesting institutional anomaly. Therapists and the anomaly is this. Therapists and counselors whose job it is to guide and heal under administrative pressure are asked or required to assume quasi-disciplinary functions and responsibilities. And administrators, whose job it is, among others, to administer discipline, are counseling disruptive students about their need for mental health services. It's kind of an interesting situation, and it's almost universal, I think. I will explain in a later section. What are we doing on time?
It's 10 to.
And when will you?
We're supposed to finish at 10:30, so
30. Okay. I'll try to.
probably we should wrap up in about 10 or something.
Okay, I'll try to move a little faster. I will explain, if I have the time, to some alternative means for this quandary. Instructors whose requests for immediate administrative intervention with a disruptive student are denied are normally faced with several rather unpalatable choices. They may simply accept the administrative decision and painfully bide their time with a disruptive student until the disruptiveness either somehow subsides or further escalates. In the event that it persists or escalates, the ensuing escalation may then provide the college with sufficient grounds for administrative action. Instructors will then be able to repetition the college with stronger evidence of the students' continuing disruptiveness and hopefully provide a more convincing record of their adherence to this process. A second choice. If instructors consider themselves extremely endangered by the retention of a disruptive student in their class and yet cannot secure administrative support for removing that student, and where the student's behavior seems to be in violation of the law, that is either a misdemeanor or a felony, then the instructors may exercise their civil and constitutional rights by filing criminal charges against the student with their local police departments. In lieu of, or in addition to this measure, they can, if necessary, seek to enlist the assistance of the courts to have a restraining order placed upon the endangering student, or the college can do that. A far more extreme and controversial step for college employees who believe that they are unduly imperiled by the inaction of their colleges in dealing with a particularly disruptive student is to threaten or to carry out a legal action against the college in their own behalf. Such action, if taken, would probably be based upon the charge that the student is seriously interfering with the civil or constitutional rights of the employee. Obviously, such an extreme measure can be fraught with considerable personal and professional risks, and therefore should ordinarily not be undertaken without a good deal of circumspection and the benefit of expert legal advice. Considering the many reasons that underlie a general aversion to discipline, it is understandable, as Pavella has importantly stressed, that the administration of punishment often requires considerable moral courage. Because of the widespread aversion to the administration of discipline, it's quite common for college administrations to require that the disruptive student receive psychiatric or personal counseling as a condition of either continued enrollment or re-enrollment in the college. Although this practice may in part be motivated by a humane recognition that the disruptive student is a victim of emotional stress as either a cause or effect of his disruptive behavior and therefore could conceivably benefit from psychotherapy, there are several reasons why I think this practice, and I'm talking about the practice of making it a requirement, I'm not talking about the practice of referring people to therapy, I'm talking about making this a mandatory measure. You must go, or even anything close to that. There are several reasons why this practice, I think, should be discontinued and abolished. Now, one of the reasons I offer is that requiring a student to receive psychotherapy distorts and undermines the basis for corrective disciplinary action. The focus and impetus for disciplinary action is the disruptive behavior of the student, not the student's putative mental illness. There's more I could say about that, but I'll try to shorten this a little bit and move on to the next point. Secondly, the requirement of psychotherapy for the disruptive student is often motivated by a fanciful and naive notion about therapy. One of these notions is that once students receive psychotherapy, their disruptive behavior will abate or cease. Although that's sometimes true, it's also true that many persons who receive psychotherapy remain socially disruptive and at times actually become quite violent, despite their psychiatric treatment, maybe because of their psychiatric treatment, I don't know. An analogous belief is that psychotherapists have the omnipotence not only to prevent disruptive behavior, but to accurately predict disruptive recidivism. Numerous research studies, as well as common sense, indicate that the ability of the mental health professional to predict certain forms of disruptive or violent behavior is admittedly quite limited. Okay, let me move on from there. Number 3, requiring a disruptive student to receive psychotherapy is unequivocally a coercive measure that serves to instill in the student resentment toward potential sources of help, namely the therapist and psychotherapy itself. If such students conform to this requirement of going to a therapist, and I'm talking again as an obligatory matter, they will agree to see the therapist sometimes, but frequently will invest no personal involvement in the treatment process itself. Consequently, they typically derive little from the therapy other than the impression that psychotherapy is a form of punishment, which must be stoically endured. 4, ordinarily for therapy to work, it must be conducted on a confidential basis. This is the cornerstone of psychotherapeutic treatment, and is maintained in order to instill in the patient a trust of the therapist, which is essential to the patient's welfare. A requirement that the disruptive student receive psychotherapy naturally implies that the college will be informed of the student's therapeutic activities, including perhaps his progress and prognosis. Thus, the requirement serves to contaminate and undermine the confidential therapeutic relationship and consequently limits the potential for success. 5, the administrative requirement of therapy as a condition of enrollment tends to divide the authority over the student's status in the college between the college and the mental health community. In practical terms, what frequently happens is that a therapist will recommend re-enrollment, whether it's an on-campus therapist or somebody from the community, and the administrator will feel protected and reassured by that authoritative recommendation. In reality, that recommendation affords no real protection to the administrator or to the college insofar as the student's future behavior is concerned. And that's such a common thing, you know, where my college used to do that. They used to send students out to get a little letter attesting to their ability to benefit from the educational experience, say that they were in control, they were well again. And if the person didn't get the letter by seeing the first therapist that they came across, they'd sooner or later find somebody who would write that letter. And the letter would come in and it would be almost sacrosanct. You know, they would carry this letter and people would look at it and it would say, Joe Smith is capable of benefiting. And then everybody would put great faith in it. And 2 weeks later, of course, Joe Smith was up to his old tricks again. The letter, such letters are usually not worth the paper they're written on. 6, well, I won't go into 6. 6 has to do with a federal law in the United States. It's Section 504 of the Rehabilitation Act of 1973, which talks about discrimination of the handicapped. And I think it does apply here. I don't know whether this law has a counterpart in Canada, but if it does, I think there may be some question about whether requiring students to have psychotherapy, whether that may be in violation actually of the law, because it may be discriminatory because it's treating them on the basis of their handicap. Okay. Disruptiveness versus dangerousness. There have been many well-documented studies, including those cited by Moynihan, that have amply demonstrated that the ability of mental health professionals to predict dangerous or violent behavior is admittedly quite limited. The American Civil Liberties Union has firmly stated that it now seems beyond dispute that mental health professionals have no expertise in predicting future dangerous behavior to self or others. I don't agree with that, but I think it's a bit extreme, but I think that there is some validity to it too. The inability of psychotherapists to predict dangerousness is an important fact for lay and professional persons to acknowledge in order that they may deal effectively and realistically with individuals who pose the risk of manifesting violent behavior. Nevertheless, there is a way in which this acknowledgement has only sporadic and peripheral relevance to most cases of disruptive student behavior. Specifically, if the prediction of dangerousness is at best precarious, the prediction of many forms of non-dangerous but highly disruptive behavior is not nearly so fraught with the risk of error, bias, or injustice. Most disruptive behavior that is ultimately reported by college personnel to their administrations is blatant, recurrent, and despite the best of efforts and intentions, unrestrainable without the use of disciplinary interventions. Since it's the very fact that this disruptive behavior has already become chronic, flagrant, and unstoppable that ordinarily instigates an instructor to report the student, it's usually not inordinately difficult for an administrator, perhaps with the assistance of a mental health professional or counselor, to rather accurately predict whether the disruptive behavior will continue unabated without the intervention of discipline. So what I'm saying here is that only common sense and logic would be necessary to predict that a student who week after week has been interrupting lectures with loud and inappropriate catcalls, that in all likelihood this behavior is going to continue if the person is not disciplined for it. Okay, we were down to about, what, 5 minutes?
Yeah, it's 10, so.
It is 10 now?
Yeah.
Okay.
So if we're going to have time for questions.
Okay. There are just a couple other points, and I think they can wait, and perhaps should we just go ahead with questions. And I have a couple things to say maybe later about suicidal students and anorectic students, but I think I can entertain your questions. Yes?
Oh, yeah. Could you ask them to use the mic for the questions?
Which one?
The mic in the center.
Oh, would you mind going over to the mic? Because I guess they want this on tape, so they'll pick up your voice. The mic is located in the center of the room.
Thanks.
Doctor, most of your comments would fall for us under the category of responding to disruptive behavior on campus. The subject this morning, why is disruptive behavior on campus happening, is a little bit different for many of us. I'm curious if the reason for that shift is because we all understand it, or that none of us understand it. Could you,
I can explain it, and I think I should apologize too. That was the original title, but it was because I don't think I made myself clear as to what I wanted to present. So when that title was suggested, I thought it was an interesting one and a useful one, but I thought it was one that I couldn't address with a sufficient degree of expertise. And also, I thought it was more of it would result in a sociological discussion more than something I thought that would be more useful to this audience, which would be what I've been trying to do, which is a hands-on model for dealing with disruptiveness. I suppose I could speculate perhaps right now, but perhaps no better than the rest of you about why the increase. I have suggested a few of the reasons: the rise in drug addiction, the increasing disrespect for traditional authority. I've mentioned, I don't know how much this applies to the universities and colleges of Canada, but in California we have the problem, and I guess you did say something, that there was something similar here. The depopulation of mental hospitals, the emphasis upon treating the mentally ill in local communities, which I think reflects a good degree of humanitarianism. I think I support that whole trend. Unfortunately, what happened in California and other states is that when they depopulated the hospitals, the local communities did not have the wherewithal to deal with these populations. The people returned to the communities, and the programs were set up sometimes in an incomplete manner. In other ways, they were poorly funded, and some of those programs disappeared rather quickly, and the people were left, they were just bereft. You know, they had no treatment programs to go to, and they were no longer in the mental hospitals. So what happened? Well, in California, and I think in some other states, they then began attending the educational institutions. Some instructors, some people in the colleges in California thought this is a bit of a conspiracy, actually, that psychotherapists were actually sending these people to the colleges, you know, as some kind of nefarious plan. It wasn't like that at all. What it was is that, you know, if you're treating somebody and they have an idea of wanting to go to college and learn and expand their horizons, as is the case with anybody, mentally ill or not, then they should be entitled to do that. But it happens that too many of these people did suffer from psychiatric disabilities. They weren't getting the treatment they needed, so they went to an institution, an educational institution, and it provided them with, as I said earlier, hospitable environment with structure. And some of these people did pretty well, and some of them actually graduated. But many of them couldn't tolerate the frustrations of even registering, let alone going into a class and sitting down. They just would panic. And by examination time, they would wash out. I wish I could, so if your hope was for a fuller discussion of the reasons and the whys and the wherefores, I'm sorry, I have to just apologize that my own preference was to provide the model.
Could I add something?
Sure.
Does this work? No? Hello? Does that work? Okay. I guess one of the things that we've experienced at this university is that there's been a real change from the 60s, when there was a lot of tolerance of this kind of behavior as well. And also a change to not tolerating it, and increased awareness of the necessity to report it. So it's hard to really know how much it's increasing as opposed to how much it's just being more reported. Although certainly readings suggest that violence is increasing within our world. And reading the paper these days, one only has to assume that that's true. The other thing that I think in terms of the university is that the employment situation is very different now. And so we have a lot of students remaining in school for periods of time because they can't get jobs, who might normally have gone out and not been here. And I guess the other thing too is just some of the general rudeness. You know, you address some of that at the beginning. We've gone from the swing of the 60s into much more of it. This is not so acceptable anymore. People are going to have to change how they respond and how they behave.
Just to make one other comment I just thought of, and that is that most of you who grew up, you know, who went to college during the years that I did, I went to Rutgers in New Jersey. When I used to occasionally date Douglas girls, wasn't as often as I wanted to, but I'd have to get them in at 10 o'clock at night, and the reason for that is that the colleges, you know, really served in a kind of in loco parentis, and I thought they had such heavy-handed ways of going about things. And then, of course, we had the 60s and Vietnam, and the pendulum began to swing away from that toward colleges became, you know, and college administrators became very fearful. They were really beleaguered. There were sit-ins, et cetera, and so the pendulum began to swing away from, you know, this very rigid, almost draconian way of dealing with things to a more laissez-faire approach. And I think that laissez-faire approach has been around for quite some time. And I think, unfortunately, I think that's one of the instigators of disruptiveness. It's the inability of many people to realize that they have prerogatives to discipline, and that they often don't even realize that abusiveness is taking place until it's too late. They just haven't recognized that they're in a position of authority and they have the right to exercise that authority. And I think that is a major contributor to why situations become so intense. Yes?
Dr. If I may, I'd like to ask you to comment on two specific situations, one relating to professors and the second to students. The first being the tactic used by some professors, regardless of what regulatory framework they might work within, the tactic of simply leaving the lecture hall in the face of any student disruptive behavior and unleashing peer pressure. The second would relate to a student whose only disruptive behavior is total inhibition with regard to, or with the use of the language. In other words, a language laced with expletives in any situation.
Yeah.
Comment on those two situations.
Well, a professor leaving a class, if I understand your scenario, leaving that class with the disruptive student and walking out and disappearing, of course, that's an act of irresponsibility, and I certainly think that if that's what you're depicting, and that should not be done. It's ill-advised, and if the class needs to be dismissed, if it's an emergency situation or in a dangerous situation, then the instructor would do better to dismiss the class, tell everybody to just leave together, and then go and report that. But certainly don't leave a class behind with someone who is perhaps imperiling the class. No, that shouldn't ever be done. I think that's wrong. Now, what was it? The second part of the question? I want to make sure.
Someone with expletives.
Yeah, the expletives. Yes. I'm sorry. This depends, I suppose, on you know, the sensibilities that we all have for various things. For example, I was asked by a counselor in a conference like this, about such as this one, about 3 weeks ago, about what she should do with a student who is continually swearing in sessions. And I told her that, look, you know, if you don't like it, you can set those limits. You have prerogatives. I frankly don't mind cursing. As a matter of fact, I curse a lot. So it doesn't bother me. As a matter of fact, for some people in therapy, I think it's a sign of progress that they begin to be uninhibited in that respect, at least within the confines of the therapeutic situation. But if this is done it depends on the context and the setting, and if this is being done somewhere in a classroom where it's unacceptable to you as an instructor or to someone else, then I think you have the right to insist upon reasonable conformity to propriety, you know, to propriety in language. Is that?
Thank you. With regard to the first point, it's my observation that some professors, as a standard device, simply, and without any reference to the rules and regulations of the institution, simply refuse to lecture if someone is disrupting the classroom in any way.
Yeah.
And they just walk out
Yeah.
and rely on the other students to discipline the individual.
Yeah. That smacks, to me, that smacks of a temper tantrum. And I would suggest, I don't know how you deal with that if you were an administrator dealing with that faculty member, but that person is being irresponsible. And there are certainly many things you can do short of that. You can certainly just tell the student to leave or to, you know, I mean, there are other things you can try before you just get up and walk out. You know, that's just, doesn't make sense, yeah.
Dr. Amada, thank you for focusing the discussion on the behavioral aspects, but my question relates to preventative aspects. You mentioned early on in your presentation that you raised the question, is the college providing preventative programming? What did you mean by that?
Yes, I'm glad you asked that because the presentation really doesn't incorporate enough about that, and I wish we had time for that. But to mention a few things, in California, I did a survey some years ago in California of the community colleges. There were exactly 100 at that time, inquiring about whether they had mental health services, for example. And only a third did, and even the 33 or so that did have mental health services had very small programs and you know, hiring consultants that just come in for a few hours a week. So I see mental health services as a vital component in any college as part of a crisis intervention team, as both a treatment and component, but also as a preventative component, because many of these students, when they first come to the college, are very agitated, they're very frightened. I'm talking now about prospectively disruptive students. And if those students know about this program and they avail themselves of it and they use it, then there's some chance that they will be able to adjust to the environment much better and not become disruptive. So I think that's one. In Boston, there is a program which has been pioneered by Karen Unger, you may have heard of, something of a model. And there they work primarily with the student who